Okay, another minute here. Facebook is spinning its wheels.
No, it says you're live. It says you're streaming live on
Oh,
Facebook.
does it? Okay, good.
Yep.
Hi everyone. Oh yeah, I see it now. Excellent. Magical. All right, we're almost there. We'll start in just another minute. Everybody, give people a chance to log on. We had almost 90 people registered for the Zoom, and then we'll see how many people join on Facebook. All right, 6:30 it is. So let's go ahead and get started. Hi, everybody. Welcome. Happy, what is this? Thursday. Happy Thursday. Hard to keep track of the days, but thanks for remembering to join us tonight. I am Susie Murphy, the Executive Director of the San Diego Mountain Biking Association. And this is part 2 of our How to Survive Mountain Biking. And for those of you that were with us on the first session, this isn't about how to change a flat tire. It's not how to, make that turn or, make that obstacle. This is about how to be prepared, how to stay safe, what to carry in your bag to maybe help out yourself and your buddies when something might go a little wrong. And so that's why we're here. Part 1 is posted to our SDMBA YouTube channel in its entirety, so you can see the whole thing there. And if you want, there is a place on the YouTube to add comments or questions. So if you do want to add anything there or have any questions, we can try to field those questions from there. Tonight, we're going to go a little deeper into preparedness, how to prepare for certain situations that might arise out on the trail or in the backcountry, and more like extreme situations that might arise while you're mountain biking or out on the trail. So for questions, if you're watching on Facebook Live, you're welcome to put questions or comments into the feed directly there, and we'll try to field those as we can. And if we have any time at the end, we can field some of those questions. You can also, if you want to put any questions into the Q&A box at the bottom of the Zoom call, you're welcome to do that as well. So lots of places to engage with us, and we're happy to have you here. So let's get started because we have a lot to cover. So I'm going to first introduce Dr. Sylvia Santiago. And as the panelists come up, they will introduce themselves, and appreciate all you amazing women being here with us talking about this and helping to hopefully keep everybody safe. One other thing I was going to say, the reason that we thought about doing a program like this is because we're really concerned about people being safe and not getting hurt at this time. Hospitals are overwhelmed, and they really, especially at this time, don't need any extra people in there with broken collarbones or anything else while they're dealing with everything else that's going on. So just try to take it easy, and remember our healthcare workers. And anyway, that's it. So I'm going to introduce Sylvia and let her kind of tell her background, and we'll get going.
All right, everyone, welcome tonight. Again, we're starting session 2 on how to survive mountain biking. We're going to go a little bit more in depth tonight on first aid and how to handle certain situations. So I'm a physician. I'm also a current member of the Academy of Wilderness Medicine, and I'm a fellow of the Academy of Wilderness Medicine too. And I'm going to let my fellow panelists introduce herself now.
Tonight's going to be a lot of wilderness medicine, so you need to buckle your seatbelts. We're going to be doing a lot of covering topics tonight. My name is April Ortley. I'm a wilderness EMT, member of the Wilderness Medical Society, and a member of Women in Aerospace Medicine. I'm also a chemistry major at the University of Washington. We have a special guest tonight. Dr. Wessner is not only an incredible physician and close friend, but also is an impressive and strong mountain biker. I'm so happy to have her with us tonight, and I'll let her introduce herself.
Hi, everybody. I am Catherine Westner. I'm the head of allergy at Scripps Clinic here in San Diego, and you're wondering what in the world is an allergist doing talking about wilderness medicine, but there are a number of allergy urgencies and emergencies that can come up while cycling or being in the backcountry, so I'll briefly touch on those today so we can all be better prepared.
All right, thank you. Okay, so now we're going to talk a little bit about the topics that we're going to see today. So first of all, a brief review of session 1. Then we're going to talk a little bit about how to respond to an emergency. The Good Samaritan law, what entails law-wise if we decide to help someone on a trail. Snakebite case studies, since a lot of you had some questions last session. First is an introduction, allergic reactions, mechanism of injury, most common injuries in mountain bikers, and lastly but not least, how to evacuate ourselves out of there. So now we're going to talk briefly again about the 10 essentials, very important. Make sure you carry 10 essentials. As we get better on our sport, we reassess the gear that we bring. But again, always bring something to navigate, know your map, know your way around the trails you're going to visit. Sun protection, very important. Last session, we discussed a little bit about heat stroke, dehydration. So sun protection, staying hydrated will help with this. If you would like to know a little bit more about this, please, we recommend you view the first session. Then again, multi-tool and a knife, very important to carry that multi-tool to fix our bikes in case we get in trouble. And also in case we need to cut a t-shirt to make those extra bandages in case we need to provide first aid and we don't have enough supplies. A knife or multi-tool is definitely very useful. Again, communication device, we're going to talk a little bit about how to use our devices, cell phones, GPS, and our watches. And then again, for those who are more advanced, things you should bring over for an overnight trip. So now, emergency contact card and road ID. Again, please, these are very cheap. They're easy to find in Amazon. You can buy a stack of these, put your emergency contact information. We're also going to distribute a little PDF file where we have a little raft of something you can print out and put in all your bags. Very important. Again, if you lose consciousness, it's going to be very difficult for anyone who's trying to aid you, know who you are. If you have any medical condition, if you take any medication, or where was the last time you had a tetanus shot, that's very important. So please include those things. Again, I put here a little video for those iPhone users. There's a little emergency contact card. So if you go to your health, like you go to the settings, then you go to your health app and you click here, and then they have the option on how to do your medical ID. And here I have a little picture of information you can put in. So very, very useful to have. Now, communicating to search and rescue. Again, if we get into trouble and we call for search and rescue, we need to know if you're in a national park, you're probably going to call the ranger service. If you're in a national forest, you might need to call the sheriff. And if you are in a local trail close to urban areas, you might just need to call 911. So it's also very important to know who you need to call for help. And again, what are you asking for? Are you asking advice of how to get out of there? Are you asking advice for resources or for a rescue? Again, very important to practice, prepare a verbal report of your problem. What happened? Are you hurt? Did you find someone unconscious? Are you lost? So very important to know so they can aid you the best. Remember, when you're calling to get rescued, time is essential. Time is gold. So the more precise you can be with the information you share, the faster you'll get that help. Then know your coordinates and be ready to describe your location. So again, here we included a little video for iPhone users. You already have an app, a compass app on your phone. So here I'm demonstrating how you can access it and read your coordinates. Again, for Android users, you probably have to download the Compass app. I don't think Android phones carry this app, so make sure you download this and know where to access it. Make sure to know any special markers of the trail you're going, the name of the trail, that you're going and more or less how many miles you're away from an exit. And then lastly, but not least, the closed loop communication. If you're gonna call to ask for help, make sure that the person you called either is your emergency contact or search and rescue, that they tell you back all the information that you said. You need to make sure that they understood your message, that it came across properly, and that they understand what you need. Now, brief summary for the search and rescue team. When you're calling for help, again, give the phone number you're calling from, time, date, and nature of the injury. Very important to let them know when you got hurt, what time, like how many days ago, especially if you're on an overnight trip. That number of victims and their status, how alive, how hurt are they? Are they breathing profusely? Did they just sprain their ankle? Very important for them to know, because that's gonna let them know how much resources they need to send, not only material resources, but also human resources. And then victims' location. So coordinates, name of the county, nearest community, name of the roads, especially if you do not have the address. And then for those people who are the responsible emergency contact, remember, you need to tell again the nature of the emergency. Did your person not come back on time? Did you call you crying for help because they're lost? You need to know this information to tell the search and rescue team. Then the name of the people in the group, very important. Let your contact person know who's going with you. Wilderness permit, if you have one, entry and exit trail names, and then your route, intended destination.
Okay, so now we're going to talk about the Good Samaritan Law. The Good Samaritan Law is in place to protect you. You can go ahead for the next slide, is fine, thank you. This law is to encourage the public to help each other in the event of an emergency. However, it will not protect you if you go outside of your scope of practice. So this means please do not try to reenact a surgery scene from Grey's Anatomy. Don't do anything crazy. Use common sense. In the beginning, make sure to introduce yourself and get verbal consent to aid. If it's a minor involved, make sure to get parental consent. The only time that you do not need verbal consent is when someone is unconscious. So after that, you want to next go ahead and call for professional help just to begin that system of emergency response, because it can be a little bit slow sometimes. So just make sure that you put in that phone call for professional help. And then also at the end of you providing aid to someone, just keeping a basic record of what happened. What time did you provide care? What did you do? And what was your plan just in place? Overall, again, it's really just to protect you as one human wanting to help another human. So it's a good thing. So now it's time for some critter talk. So first critter up is a really big kitty named Hello Kitty. In all of California, there's an estimated mountain lion population of 5,000. Encounters of mountain lions are really rare. So if you do see a mountain lion, what you do not want to do is you do not want to approach it. Don't give it a reason to feel territorial. Don't run away from it, so you don't want to seem like prey. And then don't make yourself smaller. You want to do the opposite of that. You want to make yourself larger. You want to be loud. You want to scare this animal away. And then if you are attacked, which is extremely rare, you should fight back with all you've got. To direct your attention into the lower right corner, because we have a bike, we can raise that over our head to look even more intimidating. Please don't judge my drawing. That was after a whole quarter of art class at the college, and that was what I was left with. So clearly tuition was well spent. Now back by popular demand, we're going to talk about rattlesnakes. So rattlesnakes bites. This next segment is going to involve 3 different scenarios of snake bites. Before I give you the specifics of the scenarios, I want to spend some time giving you another overview and big picture look at snake bites. In a moment, as I introduce each scenario, I want you to consider what your instinct tells you to do about each situation. If we had more time, I'd love to give you more time and have a conversation about each scenario, but this is going to be the lightning version. So let's get prepared for our scenarios. Next slide, please. Let's begin with the fact that most snake bites are preventable. Snakebite victims are 90% male in their mid to early 20s, and they usually involve alcohol. So ethanol, which is the alcohol that you drink, and testosterone are the risk factors for snake bites. Most snake bites occur in the summer. In the lower right portion of the screen here, we see the skeleton of a rattlesnake. Rattlesnakes are a type of pit viper. This means between their nostril and the eye, there's a some anatomical features that allows them to inject and produce venom. The purpose of venom, as it benefits the snake, is it begins the digestion of tissue outside of the snake's body. These curved tubes are what pierces the skin of the animal or person to deliver venom. So these fangs can break off in a bite, but you do not need to disturb the wound looking for them. It's also reasonable to assume that if you are out mountain biking and someone became bit by a snake, that you will be in a state of distress and you won't be able to recall what to do. In emergent situations, you do not rise to the occasion, you fall to the level of your training. So this is why folks in emergency medicine and wilderness medicine train so hard. It's also why Dr. Santiago and I are great to take on trips, just saying. In the event that this distress happens, or if you are waiting for help and you don't really have anything else to do, you can call Poison Control. Poison Control are wonderful. They're a very professional organization. They are all about toxicology and the chemistry of something that gets in your body that should not be there. So they can give you the same tips that we did, and they can provide just more support for that emergency scene. So we've included this number here, and also the number is in the PDF. So the big picture of snake bite management. So the good news about snake bites is that 30% of them are dry bites. So that means no venom was injected into you, and it's simply a puncture wound. So your overall goal as a snake bite victim, and what I really want you to take away from this, is you want to keep your heart rate low. And then you also want to be able to treat and just manage your wounds at a basic level. So the actions that you can take to support these goals is staying calm and staying hydrated. So that means stop drinking alcohol if you happen to have been drinking alcohol before. You can immobilize the limb at or above heart level. The reason that there's a little asterisk by the above is that as you raise that limb over your heart level, you're getting more of that venom into your circulatory system. So you want to be closer to definitive care at that point, but it's just better to have that at your heart or body level. You're going to want to clean the wound. So that's with one of the syringes that we included. And then hopefully you will have a separate water than your hydration pack to use. But if you only have your hydration pack water to use, then you have to do that. Removing rings and other constrictive items such as shoes, you really want to monitor swelling. That's the big thing with snake bites. As we see in this picture, we have rings around the perimeter of the swelling with the time. This will really allow the physician and the toxicologist on your case once you get to the hospital to make the determination of whether antivenom is needed. So just make sure to monitor that. And as you immobilize the limb, making sure that circulation is not impacted by that splint and swelling. So in scenario one, you're out in Penasquitos Canyon with a group of 3 friends. You're close to an access road and there are other trail users around. So the big parts of this situation is that you are in a group, you have cell phone service, you're in a populated area, and you're near major roads. Because you have the buddy system in place, someone can go ahead and call for help for 911, and you can get your friend, let's say, off the bike and immobilize them. You want to first make sure to not be in the area where the snake can bite you guys again. You want to make sure that you're in a safe location. You don't need to chase after the snake. You don't need to try and kill the snake. We don't want any more victims. One is already too many victims. So making sure to just make safe decisions and getting that person to a safe location to wait and rest and keep that person calm and immobilized. In scenario 2, this is when you're by yourself, which is totally, it's reasonable. It's not like you're the bad guy for biking by yourself. I actually went for a mountain bike ride this afternoon alone. So it's not a sin to mountain bike alone, but you're out there's just more inherent risks with that. So in this scenario, you're out in Mission Trails Regional Park alone going for a routine mountain bike ride. You're close to an access road and there are other trail users around. So we have several options here. And again, we want to choose one that will keep our heart rate low and allow us to get in a better situation for help. So what we could consider to do is we can consider moving to a trailhead, a place with more people around, which means more resources. We can also consider, like, if we are really close, like ridiculously close to a road that's downhill and flat, we can consider getting to that road and calling for help. Again, it's going to depend on your location. So it is possible, yeah, you would have to move in this situation, or it's possible that, you know, there's someone else around you, and you can stay and you're at a big access road, just to try and speed up that emergency response. Because if you are on single track that's really dense and wooded, it just limits the options that search and rescue will have to get to you. So to just try to open up your options and get you help a little quicker. But you can also, so laying down and resting and awaiting search and rescue could be a completely reasonable decision in this scenario. For the next scenario, which is our last one, so this is when you're in Hamul. You've done this bike ride frequently, you're all by yourself, you rarely see anyone, it's incredibly remote. For this one, I think you do have cell phone service in Hamul, but I put a question mark there. Just say we don't have any cell phone service and we're completely by ourselves. So in this situation, we want to try and reduce elevation gain on route. So as we are trying to get to a road or get to cell phone service, we want to pick routes that are flat or possibly downhill if possible, just to keep that elevation gain low. We want to head for fire roads or really big open roads or areas that could potentially have a helicopter come. But again, just keeping that heart rate low is just the name of the game. When you're all by yourself and you don't have cell phone service, your options do become severely limited. But thankfully in San Diego, we do have pretty good cell phone coverage. Yeah, so yeah, you can go to the next slide. Thank you. So the big takeaways from snakebite management. So in wilderness medicine, there's no one size fits all answer here. So the big things to really take away is you're going to have to make this decision yourself. So taking into factors of location, where am I? How close am I to roads? How close am I to a major trailhead? And what kind of resources are there? And that also means human resources. So am I alone? Am I in a group? With those resources, then you're able to make the decision of, am I going to stay in one place or am I going to try and go get help? So for staying in one place, you're going to stop, you need to contact help, professional help, and then you're going to go ahead and get into your treatment and management of the wounds. So that means immobilizing that affected limb, cleaning it, monitoring the swelling, and waiting. For going for help, just make sure that you can take resting breaks if you have to travel uphill. But just making sure that you have a thoughtful plan in place for why you want to move and like what it hopes to open up for you. So each emergency demands its own unique response. It's what practicing medicine in remote environments is so incredibly difficult. And this is the same reason that I have an absolute passion and fascination for wilderness medicine. It requires practiced critical thinking and making big decisions with limited information. This is another reason why taking classes in wilderness medicine is extremely important, to give you that practice, to give you that confidence to deal with scary situations. Susie's going to be emailing out a PDF to you soon that Dr. Santiago and I have created, and on that document there is information regarding online and in-person wilderness medicine courses you can take.
All right, so considerations before a ride. We discussed a little bit again last time about useful apps. Also, before I go a little bit into the first aid, one thing that I always recommend to people who engage in outdoor sports, especially rock climbing and mountain biking, make sure your medical insurance will actually cover you. That's very important. We don't think about that, about getting hurt, until unfortunately you have a friend who got hurt and then you see that hospital bill. So make sure your medical insurance will cover you. I know Garmin, if you pay for the GPS membership, they do offer some types of insurance where they even paying this membership actually even makes you eligible for this insurance for helicopter. If you need to be rescued, they actually cover the helicopter fee. Again, with the Wilderness Medical Society, also if you become a member of them, they also offer you insurance for these type of activities and they cover up to $50,000. So just an idea to get that into mind. Very important. Then again, plan ahead. Know how to use everything that you carry. Always repack your first aid kit for after every trip, especially if you buy those pre-made first aid kits. Again, please open them up, see what's inside, and make sure you know how to use it. Then again, they're not bringing things you did not know how to use. There's no point of bringing it if you're not gonna know what to use, like how to use it. And then again, try to go with people that know what to do. So go with someone who's more experienced, who will help you out if you get in trouble, if your bike is not working correctly as you get better, and get that first aid training. So now, first in the COVID-19 era, again, here we're just giving some pointers if you are offering help. Here in this picture, April is unfortunately my victim, and I found her in the middle of the trail, and I'm here trying to provide some aid. So before I approached her, I try to keep 6 feet in between. I put on my PPE because I don't know, is she bleeding? Are there secretions? So I need to make sure that I'm safe first, right? Then I try to ask them to put on their mask. Hopefully, in this case, she was carrying a mask and not only her butt. So that was really nice of April. And then I sanitized my hands. I introduced myself. And again, I asked if they need help. So then we here have a little video. When you are gonna offer first aid to someone, you need to sight, see, and size up. That's how we call it. So here we have a little triangle that we also put in that PDF file. And here we ask a few questions, right? I'm gonna play the video first and then we'll go over the triangle. All right, so that was a little introduction of more or less things you need to see. So before you give help to anyone, you aid anyone in the wilderness, you have to always make sure that you are safe. You already have one victim, we don't need a second victim. This is a great example for snake bites. If your friend got bitten, don't go chasing after the snake. Let it run away. Help your friend first. We don't need a second snake bite. Then, so now we know you're safe, you're able to approach. Then ask yourself, like, how alive is that person? Like, how emergent has to be that attention you're going to give them? Then also ask yourself, how many more? Because you need to think, how are you going to split your human resources versus your material resources? Do you have enough resources to go and eat them? Then we also ask ourselves, make sure that we are protecting ourselves from blood and secretions. That's very important. And again, threats of life, if that person, like, is they gonna get hurt more if we move them, or if there was like a rock slide, make sure that they're not gonna get more hurt. So these are things that, again, you're gonna learn in a first aid class. All these topics go beyond our webinar for today, but it was just an idea to get you thinking of things of what you're gonna learn when you attend to these courses. So injuries, illnesses, and interventions. Now I'm gonna let Dr. Katie talk to us.
All right, so we're going to do a whirlwind tour of some allergy issues that you might encounter mountain biking or out exercising, and you'd be like, okay, how relevant is this? So I'll tell you a true story. I had first moved to San Diego many, many years ago now to do my fellowship in allergy and immunology at Scripps, and I was out mountain biking in the Cuyamacas, yes, by myself. And I came across a woman and her husband, and she was on the ground, broken out from head to toe in hives and was having difficulty breathing. And it turned out she had exercise-provoked anaphylaxis triggered by non-steroidal anti-inflammatory, so by ibuprofen. So what are the odds that she would have an allergist stumble upon her and was able to help her? So I knew at that point that I was in the right place, and I've never left San Diego. So in the top right, you can see a picture of hives, but they're really tiny pinpoint hives, almost like the size of a pencil eraser. And we call those cholinergic urticaria. And some people get those with exercise. So when they exercise and they get sweaty, and as there's evaporative cooling of the skin, you can get these cholinergic urticaria. It can be bothersome, but it's most of the time not particularly problematic, but that can be treated. The bottom picture is a more typical picture of hives, and you can get hives with allergic reactions. So if you happen to get stung by a wasp or a yellow jacket or a honeybee and you're allergic to those, they can trigger hives and other symptoms. Again, some people can have exercise triggered hives. They can have food dependent exercise triggered hives. And then there's people with food allergies, and you think, well, food allergy, I'm out riding my bike, it's not such a big deal, but it can be a big deal. And this is where it's important that the people that you're riding with know what your allergies are. So you may have a friend who's like, oh, here, have an energy bar. It doesn't have any of your allergens in it. And lo and behold, it does. And now you're out in the middle of the wilderness and having an allergic reaction. So your friends need to know what you're allergic to, where you keep your EpiPen or auto injector of epinephrine, if it's AutoQ or a generic EpiPen, and they should know how to use it as well. Then you can also have asthma triggered by exercise when our our pollen levels are particularly high. So if we've had a wet winter and you're riding through lots of pollinating wildflowers, AKA weeds, they can trigger asthma symptoms and even close to an anaphylactic type picture. So you need to be aware of what your allergies are and where you're going and what the potential exposure might be. So the next slide. So what do you do if you have an allergic reaction? So just like the snake bite, you want to stop exercising. Exercising further exacerbates an allergic reaction. So you definitely want to stop. Don't keep riding your bike after you've been stung by a bee. If you know that you're allergic to a bee, again, please make sure that you always ride with your auto injector of epinephrine, even if you don't think you're going very far from home. People who are allergic to bees seem to be very attractive to bees, so just be prepared. And again, make sure your friends know where you keep the auto injector of your epinephrine in your Camelback. And again, if you're riding with someone, just say, hey, here's where it is and here's how to use it. There's a number of options. We won't go through them tonight, but you have your EpiPen. It comes as a generic now. You just take the cap off and then it's ready to go. Please don't do the Pulp Fiction approach and jab it into someone's heart. It just needs to go into the lateral aspect of their thigh. It can go right through their cycling shorts or tights or pants. And you want to hold it for a count of 3 if you can. Better yet, I like the AviQ, which is a much smaller device, much easier to carry around. More importantly, if it's not you that has to give it, it actually speaks to you. So it'll walk you through actually how to administer the epinephrine. And just like the snake bite, you might be in kind of a panic state. And this is nice because it keeps you from having to think about what you're doing. So the first thing, you get stung by a bee, you're allergic to a bee, or even if you're not allergic to a bee, you really want to try to flick the stinger out. The venom sac is at the base of the stinger. So if you squeeze that, you can get more venom in the area. I recommend taking an antihistamine immediately. My go-to antihistamine would be Zyrtec or the generic of Zyrtec, which is cetirizine. I prefer it over Benadryl. You don't have to worry about sedating side effects when you're out in the middle of nowhere. You don't need to be kind of drowsy on top of everything because you may make the wrong decision. The signs and symptoms of anaphylaxis can be quite varied. Anywhere your body communicates with the outside world, you have mast cells that can release histamine. So if they get activated in the skin, you'll get hives. In the respiratory tract, you'll get chest tightness and wheezing, shortness of breath. You can get tightness in the throat, trouble swallowing. And then patients will describe an impending sense of doom. If you're having that sort of a symptom or dizziness, that's really the time that you need to be thinking about using your epinephrine. Please don't rely on an antihistamine to treat anaphylaxis. It will not save your life. Some people also, if they have a tendency towards asthma, can wheeze in those situations. So I'd also carry your inhaler with you when you're exercising. Next. I will give a little plug. If you are known to be allergic to venom and you like to exercise outdoors, you live in San Diego, you can be outdoors all year round, you should consider doing allergy desensitization for venom, just so then it becomes less of an issue. Always make sure you have your medications with you. I also would recommend, if you've had any of those exercise triggered hives or other situations, potential food allergies, don't rely on your primary care physician. I would think about seeing an allergist so that you can get specialized care, so that you can more safely exercise and do the things that you want to do without worrying about being killed by your allergies. And I would also consider use of a non-sedating antihistamine if you're going to exercise outdoor during our peak pollen periods. And one last caveat on the anaphylaxis: if you're having an allergic reaction, or you're tending to someone, as April was instructing you to do, if you're helping someone and they're having an anaphylactic episode, do not sit them up abruptly. People have died from that, from the empty heart syndrome. So your blood vessels are so dilated, you don't have any blood pressure, and you abruptly sit them up, the blood just drains from the heart, and then that's not good. That has a really bad outcome. You don't make it from that. And then the last slide. So I was just going to give a little update on the poison oak, which is a big issue here throughout San Diego County. If you know that you're sensitive to poison oak, so the reaction to poison oak is a delayed type hypersensitivity reaction, as Dr. Santiago talked about last week. One option is not perfect, but you can use, it's almost like a sunscreen for poison oak. There used to be a product called Ivy Block. I don't think that that's easily accessible anymore, but you can use IVX, which is similar. You can get big tubs of it and use that prior to exercising. When you get done exercising, part of the hypersensitivity reaction is the amount of time that the oil from the poison oak actually spends on the skin. So there's a scrub called Technu that's really good at getting that oil off the skin. And I would wash immediately after being in an area with poison oak, and make sure you wash all your articles of clothing and your cycling gloves, as they can retain the oil. And the rash, just as a caveat, is not contagious. So your significant other is not going to catch poison oak from you once you have the rash. And neither of those two products that I'm showing actually will do anything for the rash. It's more preventing the rash. And typically you'll need a topical steroid to clear the rash. So that's a brief overview of some of the potential issues that you can have from an allergy and immunology standpoint. But I'll be happy to answer questions offline if you have them.
All right, so now we're going to move forward and we're going to talk a little bit about scrapes and cuts. So here it's like scrapes and cuts are one of the most common mountain biking injuries. I actually asked a few of my mountain biker friends if they could send me pictures of some of their little accidents. These are real, these are my friends. Wes, thank you for sharing this picture of your shoulder. Again, we're going to talk a little bit about shoulder dislocations. Then this is my friend Karen. Here, her injury, you don't see that it's that deep, but she actually needed 4 stitches in that knee. And then here, sorry, this is moving forward. And then her leg, she ended up needing quite a bunch of them. So then again, first of all, we need to control that bleed. We need to assess how deep is that wound. So that's where we take out our first aid kit and we make sure that we have those gauze to make sure that we're putting enough pressure, especially if it's a deep wound. Don't use your fingers to make pressure. Try to use your whole hand, try to use the fist, especially if it's a big wound closer to one of the big arteries, if it's the inguinal artery. Hopefully that doesn't happen, but if it does, like, you need a lot of pressure. So again, you know what, we want to elevate that member. And then we're going to do a tourniquet if it's profusely bleeding. If it's very profuse bleed, that's the only time we're going to apply a tourniquet. If it's a snake wound, remember we said we do not do a tourniquet for those. And then we're going to clean the wound. Again, if you're close to a medical emergency, urgent care, you know, clean that wound. Try to not use a hydro pack if you are in a very remote area, remember you guys mountain bikers get to go very fast and very far out. So I always recommend to bring that filter and try to carry a filtration system. If you are in this case where you're gonna need to irrigate profusely a wound because it's covered in dirt, try to use a filtration system and not your hydration pack. Again, if you by any chance encounter you got cut or your friend got cut and you're the one providing aid, make sure that you're at least using a liter of water to irrigate that wound. It doesn't have to be at super high pressure because you're gonna damage the tissue. So, just make enough pressure to get rid of the dirt and then let a medical professional take a look at that. Now, head injuries. Another important thing. We talked last session about the importance of using your mountain biking helmet and how to properly position it. Again, this is very important. When we tend to fall, we tend to put our hands and try to protect our face, but then we can still hit our head against rocks in the ground. So important things to look out for when someone hits their head. If they are complaining about a blurred vision, or they say they're seeing double, or they're seeing stars, if they have nausea, vomiting, or they don't remember what happened, that's very important. For those, we still consider them as a mild head injury. We should be making sure that we are evaluating that person during 24 hours, that we're not forcing them to read things, or we need to let them rest. And then if it's a severe head wound where we see like there's fracture, there's blood coming out or liquid coming out from their nose and ears, then that's very serious. We need to get that person out of there immediately. Again, if the person lost consciousness and then they woke up, that's another reason for us to evacuate them immediately. We need to have a medical professional see these people. So in short, every head injury needs to be seen by a physician. Now, a little bit of splinting examples. We're not going to go too much into how to do proper splints. This is something that you're going to learn in first aid classes and courses. But I know last session we discussed about SAM splint and this really cool, it's like a foam material with some aluminum in it. And you can kind of fold it and mend it and use it to immobilize and create splints for different extremities. So here we provided some pictures what you can use. Also, if for example you don't have a SAM splint, we also put a little picture that you can use sticks to create a little splint for an arm. And another thing, we all carry backpacks when we're out there mountain biking. So you can also use your backpack, t-shirts, and maybe some straps to create a splint. So this is another idea. This is something that we use a lot in the wilderness setting. You carry a foam pad, a sleeping pad. Backpacks are like our favorite. The bulkier and the ugliest your splint, the better. April will tell us a little bit more about that.
Okay, so now our next little segment is
April. Can I interrupt for just a second? There was an abbreviation in the previous slide, LOR, about the head injuries. What is LOR?
That's level of responsiveness.
Okay.
So that is like, are they able to talk to you? Are they responding to verbal cues? Are they only being able to respond to pain or to touch? So that is something that you would get more into in a wilderness course, but that is a big indicator of how serious it is. Obviously, if someone's not talking to you, that's like always a little scary. But there is, if you can do like a sternal rub on them, so against their chest, and if they respond to that, that's something to do. But again, that's kind of more of getting into a better first aid class.
I think something that it's really helpful when we assess the level of response is to ask if you know what's your name, where they are, that the date and the place. That's very important. So if they can't respond to any of those questions, for example, like we always say, like, do you know where you are? Like if they can say, oh, I'm in a national forest, do you know who the president is? That's a really big question that we always ask, because that kind of let us know if the person has a sense of time. So if the person is incapable of responding to one of these, then we say like, oh, they're not in the whole 4 spheres of responsiveness. Okay, April.
sorry. Okay, so now we're going to talk about orthopedic injuries in the wilderness. So for all injuries in the wilderness treatment depends on the medical experience of the group and the distance from definitive medical care. So the goal is to make the patient as functional and comfortable as possible, thereby facilitating self-rescue and limiting outside resources. If you suspect a fracture, there are 3 general things you should do, which are look, listen, and feel. So the first one is look. The first thing you should do is visualize the injury. This may require removing clothing or even cutting clothing. It's really important that you have that knife or multi-tool with you. Removing socks and shoes. Do you see any obvious signs of fracture? Is there a deformity, angulation, discoloration, or swelling? A helpful trick in determining swelling is using the fact that the human body can be a mirror image if cut from a line down our nose. So we can compare the injured wrist to the uninjured wrist, which is really helpful for swelling because maybe your friend just has fat wrists and it actually isn't swollen. So after looking at the injury, the next thing we do is we listen. So listen, talk to the injured person. What was the mechanism of injury? Is it reasonable to suspect a fracture? Did they hear anything break, snap, crack, or pop? Is there a decreased in normal function? And how willing is the patient to use that injured area? The last big thing is to feel. So this is going to be a little mini physical exam. So you want to check 3 things: circulation, sensation, and movement. So circulation, is there a pulse in that hand or foot? For sensation, if you squeeze their finger while their eyes is closed, can you tell which finger it is? So you don't want to just do the ring or the middle finger because no one really knows what that finger is. So a big one is to do thumb, pinky, or the pointer finger. And movement is, can they move their fingers or their wrist? And oh, Sylvia, the screen share went down. Oh, did she get dropped or something?
She may have.
Okay, I can share my screen.
Okay.
Yeah.
Just act it out.
Right? We can totally, I can keep going. Rolling with the punches. Okay. Alrighty, let's share my screen.
There we go.
Beautiful. Present. Okay.
Thanks, everybody. This is our planned intermission.
Yeah, this is.
Go grab a beverage.
You know, this is it's fine. Okay. Beautiful. Okay. So for fractures, after we feel, so we want to make sure that we just want to check, is there a pulse? Do they have sensation to that part in their body? And for movement, so just are they able to move their fingers or toes? And what is kind of just to get a better sense of that injury. So next we want to immobilize it. So that can mean immobilizing the joints above and below the fracture. So that's really important to do just to keep everything as in line as it can before going to a hospital. Another thing to do as well is just to make sure that there is no constriction happening. So taking off rings, anything tight in clothing is really important to do when seeing a fracture. So, and after you make this splint, you can actually practice your splint on an uninjured person if there is someone in the group, just to make sure that it's comfortable. So splinting is key. When splinting, make sure you have tons of padding. It's important for splint to be well padded more than it is to be rigid. So there was a picture of just plain sticks against someone's arm in a little clip art image. That's not necessarily what we want. We want to have lots of padding between the rigid support and the person's leg or arm. And so having those extra layers with you is really helpful for making that padding. So just to reiterate what was introduced, us mountain bikers, we're super buff. So our splints need to be buff too. It's a different type of buff, okay? So don't get offended. For buff for a splint is big, ugly, fat, and fluffy. So that's what we want in a splint. We want a giant splint as seen in this picture right here. So in making that giant splint, it's really good to have extra layers, and all the clothing that you can have, just to make sure it's more comfortable for that person. For an open fracture care, so this is a fracture that you don't necessarily want to see, is an open fracture, and this is when the bone breaches through the skin. It's also, for this one, it's very similar to the basic fracture of making sure to immobilize the joint above and below the fracture site. But in this one, we can irrigate the bone end. So we really just want to clean it, get all that dirt off. We don't have to scrub it. It's going to likely be pretty painful for a patient. And then we want to keep that part moist. So having gauze pads is really helpful to cover that area of open skin. And you want to protect that fracture site. So, and obviously we want to make sure that our splint is not causing our patient any more pain than possible. So just making sure that it's nicely aligned. This is a pretty big medical emergency. And then especially when you're exercising, you're having a lot of blood in your muscle tissue, just to provide that oxygen while you're exercising. So there is an increased risk of losing so much blood volume that you can go into shock. So this is a medical emergency and requires advanced medical care. For dislocations, this is like a really big topic, and it's one that a lot of different parts of your body can become dislocated, but we're just gonna focus tonight really on the shoulder. So the main signs for dislocation are restriction of motion, deformity compared to the uninjured side, and the patient may be lifting their arm away from their body at a weird angle. I've seen a patient before where he was like holding his arms above his head and kind of doing this kind of rotation of his hands too, just to try and find, to reduce pain and find that position of comfort. So when we have someone doing this or at a weird angle, we can kind of assume more that it's a dislocation of the shoulder. Usually if there's an upper arm fracture, people are more likely to hold their arm to their chest wall or to their body to be more supportive of that. So just kind of something just to keep in mind of, oh, is it this or is it that? So there should be an evacuation if there's a lack of medical expertise. In a wilderness like first responder course, so that's kind of like the middle level before EMT, you're trained on how to reduce common dislocations, just because it's so much easier to reduce the dislocation as soon as it happens rather than waiting a couple hours, just because swelling and muscle spasms begin to happen. But that needs to be done by a professional because you can cause damage. Just shoulder dislocations, especially, people can like live their life and have them like especially common. So they will be the expert in how to reduce their own shoulder, and then maybe you have to assist them, but in that case, it's not their first rodeo and they really know how to do that. And so this swing and swath is what we showed on this right side image here. And this is something that you'll get really comfortable practicing with in a wilderness first aid course, is this triangular bandage. It's kind of this really applicable, practical, easy to use kind of device, I suppose is the right word. And then we can also use this same thing for a clavicle fracture. So it's all about just splinting and then making sure that you have something that holds that injured arm to the body, just to keep movement from occurring. For eye injuries, these ones, so if it's just a foreign body in the eye, we can just irrigate with water. Oh no. Okay, I feel like my Zoom share quit on me. Did that happen again? Oh no. Okay.
It's working.
Yeah.
Oh, it's working? Okay, cool. Awesome. Sorry. Okay, eye injuries. We have little gremlins tonight. But okay, so we don't want to rub it in. We can remove the foreign body by irrigation with clean water. And if something is actually impaled in the eye, we want to evacuate. We don't want to try and remove something from there. We want to go to a medical professional for that. Eye injuries, thankfully, are largely preventable. So wearing sunglasses is really recommended. You can also prevent your eyes from getting sunburned. Usually we just think of our skin being sunburned, but our eyes can as well. If you're going like after midday, you can get like clear goggles, or even at nighttime, a lot of riders will have ones that are tinted a little bit more yellow to kind of help with that night vision. Okay, dental problems, which is weirdly one of my favorite things in wilderness medicine. So for a broken tooth, It's pretty obvious when someone is having like a chipped tooth or they lost their filling or a cavity. It's really like pain when exposed to air or drinking things that are too cold or too hot. By taking like a flashlight on your phone, or if you have a headlamp, you can kind of check out their mouth and see what's going on. If there's bleeding, we can stop that with some gauze. If biting down causes pain, then we can roll up a little piece of gauze and put it in their back molar just so that that pressure doesn't exist there. We can also give them some pain medication, but that would require a dental visit. So the next is for a knocked out tooth. The most common facial fracture in a mountain biker is the jaw. So it is very reasonable to assume that a tooth could be knocked out while on the trail. So what you want to do here is you want to gently rinse that tooth, and hopefully, again, you'll have some water other than your hydration pack, but that's okay if that's the only thing you have, just to get all that dirt and grime off of it. If it's a bottom tooth, you can put that tooth back in its socket. But if you cannot get the tooth in, or if it's like uncomfortable, or if it's a top tooth, then what we can do is we could put it in a solution. Like if you have a little plastic bag, you can have your patient spit a ton in some water and then put the tooth in there. Or what you can do is wrap the tooth in some gauze and have that person hold it between their cheek and their gum, just because your saliva is at like the right pH and chemistry to keep that tooth nice and healthy while you're trying to get to a dentist to hopefully reimplant that. So if the socket is bleeding, you want to place that gauze roll in that socket, a separate one from the one with the tooth, and you can just apply some pressure to help stop that. My instructor actually for EMT school was working with the wildland firefighters in Montana, and she had one of the firefighters knocked out his tooth, and she kept that tooth in gauze in his mouth for like 4 days. And so that was like pretty crazy to me, and they were actually able to reimplant that tooth. So just making sure that you do that in the case of a tooth getting knocked out.
So April, the slides aren't advancing anymore on the screen.
Okay, let's see, I fixed this last time. Let's see, how is it now?
Nope,
Okay.
now you got it.
Thank you.
Okay, so now this is the last segment of our presentation for tonight. Sorry for that computer crash. Next. Okay, so things to consider. As April said, wilderness medicine just throws you ball curves left and right. You are never going to be 100% prepared, even if you, like we said last week, the perfect first aid kit does not exist. But just try to prepare for what are your needs, the needs of your crew who you're mountain biking with, and what are the most common injuries you might see in the outdoors. So then again, things to consider when to evacuate. So first of all, how alive, how urgent does your person need to get out of there? Then the distance to the nearest road. So how far away are you from? Can you walk out of there by yourself? What's going to be faster for you to reach the nearest exit or for you to wait for search and rescue? And these are things that, again, when you call for search and rescue, when you call for those emergency response systems, they're probably gonna guide you of what it will be the best thing for you to do. So on that aspect, like, you should not worry that much, but it's always good to think ahead in case you're unable to communicate. And then again, terrain difficulty. Are you uphill? How steep is it? How easy it is for them to reach to you? Here we have a picture when we took the wilderness first aid course. We're carrying a litter here, actually carrying a patient. And where the terrain is very steep or very, you don't have there's not enough room for a helicopter to land, you gotta have to carry that person out. So again, make sure that that search and rescue team, who are usually volunteers, they have enough people to go and help you out. So again, this is not the time for you to go and do tricks that you never tried before. We're recommending for everyone to ride at 80% of their ability. Try to do your best to not get hurt. And right now, again, technical ability and experience. Are you with people that know what to do in a place of an emergency? And internal, external support, access to landing zones, loading zones, and then how easy is the communication for search and rescue. Again, if you're going to go to areas, even if they're close to home, where signal is not that accessible, and you're going to do a 10 or 20 mile bike ride, pay that extra membership for the GPS. It's better to be safe than sorry, and then to find yourself in trouble and not be able to communicate and get that help that you need. Next slide. So we're done for tonight. And if you have any questions, please feel free to send us an email if you would like to discuss a little bit more of these subjects. I know someone made a joke there about the eye. I don't know if this was true, like real or not.
That is a real story.
Okay.
And even though it is Sean Murphy's birthday today, we don't need to entertain that story right now, but that was a true story about somebody's eye, an artificial eye came out on the trail and everybody was looking for the person's eye. So that was a real story. Yes.
Oh my goodness.
We looked for it the following week too, and we never found it.
Right?
And
Yeah.
we put gauze
Yeah,
over
they
her
did,
eye
yeah.
and taped it.
They did all the things, but the eye is still out there. So if you
I'm looking.
find a glass eye.
On Upper Noble Canyon.
So, but I do want to make a point. I know it was like a joke about the fake eye, but if unfortunately a friend or you lose a digit, don't try to put it directly on ice. Try to get like a moist gauze if you can, or saline water solution. Wrap that finger or whatever digit you lost, and wrap it, put it on another baggie, and then put it on ice. Don't put it directly, and make sure that it gets saved to urgent care where they might try to put it back on you.
So we did have a couple of quick questions. Cameron asked, is it helpful to ride in familiar terrain as well as riding at 80%? I assume he means at this particular time. Early on when all the closures happened, there was a phrase that came out that was not far, no car, not far, no nar. Basically like ride close to home, take it easy, don't ride the chunky stuff so you don't get hurt. So I would say, yeah, ride familiar stuff for right now if you can. And there was another question about snakes, back to snakes again early on, about if you do get bit and you're by yourself, if you're riding over flat terrain, like how far could you get, like a mile back to your car before, something happens? I guess it would depend on the amount of venom that you had in your system. There's a lot of variables there, I would assume, right? So
yeah, unfortunately, like that is an answer of like, it depends, like, do you have cell phone service to wait? Like if it's only like to wait for help to come, like, are you in a good position where you're able to wait, or are you incredibly remote and then your car's only a mile away? Like if your car's only a mile away on flat terrain, go to your car. But if you're in that super remote setting, but so it's just really going to depend on the situation, unfortunately.
Yeah. All right. Cool. Well, thank you guys, everybody, for joining on Zoom and on Facebook, and thanks to our lovely panel, who are just amazing wealth of resources. And I appreciate you guys and your time and your expertise in putting this all together. And I'm really happy we can provide this service for everybody. So if you come up with questions, post them on the Facebook chat or send them to us, and we'll try to get some answers for you. And I'll be emailing out that PDF resource page to everybody likely tomorrow that was registered for Zoom. And I'll see if I can post it up on stimba.com as well. So everybody has it, because it would be really great. The more people we can get out to do first aid and CPR classes, or do them online and then maybe work their way up to doing wilderness first aid, the more people we can get to do those classes would be great. So thanks, everybody. Good night. Have a good rest of your evening. Thank you all.
Bye.
Bye.
Bye-bye.